Hello, thank you for joining me today. I'm Dr. Brian Nichols with Balanced Baby PT. Today we're going to be going over our touches and our holds. There's different types of touch, and we want to be mindful of when each is best utilized. So the key factors that we're going to go over are really direction, which motion, are we going towards the heart, are we going away from the heart, the amount of pressure, is it a gentle pressure that is compressing the skin, or is it a deeper pressure that we're providing either for containment or where we're providing pressure to help the baby have a more relaxed position. Location is the other factor. Where we provide our massage. Are we doing it close to the area that may be wound up, holding stress or tense, or are we doing it away from the area to help the whole system relax? So direction, we have to pick which direction to go. We can provide strokes that are movement towards the heart, which are considered stimulating. We can provide massage away from the heart, which is considered relaxing. A consistent rhythm helps provide that response. It doesn't help as much when we provide a massage to the hand and we're providing that stroke down the thumb if we go fast and then we go slow. We want consistent movement. And as I'm going away from my heart in this motion, this would be considered a relaxing technique. If I were to go closer and just reverse the motion, we would be providing a more stimulating. Both can help. However, we want to just be mindful of trying to do something that is consistent with relaxing or stimulating. We don't want to go both directions. So it's not, if we think about petting an animal, a cat or a dog, and we pet with the fur, we would think of that as a relaxing motion. Whereas if we were going against the fur, that would be more stimulating or even distressing for the animal. So we want to be picky on which direction we provide the massage. The back of the hand actually helps open. So if we think about relaxation, a fist is going to be more tense. And if we want to relax that, we're going to provide that motion on the back going towards the heart. So that is the one stroke that we find to be the opposite of what we'd expect. But that's because this position, where hands are clasped, versus this position, this one is thought to be more relaxed. To get the palm to grasp, we're going to go massaging strokes towards the heart to stimulate the grasp. And that's because of where the tendons that grasp are on the inside, the tendons that open are on the back side. Pressure is important. If we think about effleurage versus petrissage, effleurage is our gentle pressure. This is going to where we start to feel some pushback, where we start to feel what we think of as like the muscle. And so we provide a pressure and we don't go deep. So we don't really compress or try and move the muscles. This is a stroking movement using the wrist. And so with this motion, it's really a wrist technique versus where petrissage is more of a moving technique where you're grasping and moving, almost like you're kneading dough. Effleurage we typically use over the head and the trunk, whereas petrissage we typically will use on the extremities. We can use petrissage, or we can use effleurage on the extremities as well to build up. And it's really important, especially for young children, infants, as they are having their systems develop, especially their skull develop. that we're not providing any of that petrissage to that area. We don't want to dig in and provide lots of pressure, which is why petrissage is really used exclusively over the extremities. Tapping and containment are two other types of touch. Tapping is important. It's what we think about when we have our baby over our shoulder and we're patting their back to get them to burp. It can help relieve gas in that situation. This is a stimulating motion, and so if we think about when a baby's done eating, once a baby's done eating, we bring them up and we get them pat, and then we expect them to go to sleep. But that tapping can be stimulating. And so sometimes I'll teach families that have difficulty with gas and reflux a more containment hold to help the baby relieve gas that is less stimulating for the system. Sometimes we need that stimulation to help the baby burp and relieve gas, but containment can be used as well. We can use a sustained pressure by depressing the skin, and it's different from a squeeze. So we're not squeezing the baby tight like if we were giving them a tight hug. We want to think of it as like the dad in this picture or parent is doing in this picture, or a caregiver or a friend, where this person is providing containment for that child to help them feel safe, relax, and control their system. Containment is typically really helpful for infants under 6 weeks, and that's when we talk about skin to skin to help them regulate their body temperature, and we're really helping the baby regulate their entire system by helping contain them. Resting hands is probably the most important type of touch. This is placing our hands on the body with no intent to move. We use it to introduce touch. We use it to bookend a massage session, so you start with it and end with it, and it can help reset the experience. So a fussy baby who really likes massage, if we go into this resting hands position and this cues them that they're going to get a nice massage that they like, what we will see in that child is that fussy baby to reset, engage with the person, and helping them reset and change the experience of what they're currently going through into a more positive transition. And so this can help bridge that gap, and it puts it on the child to give us consent, and it puts the power in their hands. Now, if we were carried around, couldn't walk, couldn't crawl, and we're reliant on other people that didn't always seem to do exactly what we wanted, then we might be in distress. Going to something that provides them a cue that, let's do something you want to do. Is this something you would like? It gives the power to them, and then they can do exactly what they want in that moment. And if you provide massage on a consistent basis, it can be not only a positive experience, but it can help break you out of any flustered experience and allow the infant to reset, and you reset as well, which goes a long way. So the conclusion for the type of touch: holding your child helps them feel safe and connected. My child has always been a koala. He's always wanted to hold on and be carried and be touched, and he finds soothing in that. However, he also, as he's gotten older, has wanted it on his terms. And by continuing to provide it on his terms, we can help him feel safe and connected to us, to allow him to reset along with us. Children less than a year old tend to do better with gentle massage, which is that effleurage, tapping, and containment. We don't want to get in and knead any muscles or really try and stretch muscles in infants and children under 1 for the reason that their system already has a lot of stimulus that they're trying to integrate. And by being gentle, those areas can relax and help the child move better and feel better in general. You can also explore different techniques with a child. So the techniques included in my videos aren't the only techniques that you can provide a child. And you may find that a certain movement or stroke with some modification goes a long way. Maybe you provide a stroke followed by containment or a little bit of a squeeze. There's no magic massage for every child. So there's no specific massage routine that helps every child. When I provide individual classes, I help parents learn what type of massage strokes may best fit their child. And so a child that has difficulty with gas and a tight torso and maybe some tension on one side of their body, I can help the parents understand what type of massage can help relieve that and help the child relax and ultimately move better and feel better. Most children do enjoy massage and touch, and it comes back to that consent-based. Some children require resting hands for multiple days in a row before you actually get into massage because they just don't want any extra stimulus. But once they understand that it is positive, that they're in control, and that when they tell you to stop in their own language, that you stop, you reset, and you're there for them. Thank you for listening. If you have any questions, please reach out to Brian at balancedbabypt.com.